So it's a beautiful fall morning. As I'm driving to work, I'm praying that it's going to be a good day. I arrive to the ICU at 7 a.m. I sit down to get report. I find out that one of my patients is a young man in his late 30s. He's married and has 2 children, one of whom is not too much younger than my own. I find out that he's a full code. A full code means that he wants everything done to sustain his life. And his diagnosis is cancer. It's in its end stages, and the physicians feel that there's not much more that they can do for him. So I go in to do my assessment, and I see that he's really struggling there. He's on an oxygen mask. It's high flow, oxygen running through. His blood pressure is very low. He has 2 different IV medications that are there to keep his blood pressure elevated. He's also on an IV pain medication drip. So my goal for the day is I'm going to keep him comfortable and I'm going to keep him alive. Later on that morning, his family, they came to me and they asked something of me that had never been asked before. They said that they wanted him to be baptized. So I told them, sure, I got this. I can make this happen. I'll just call Pastor Jim. So Pastor Jim came up, he spoke with the patient and the family, and they respectfully declined his baptism. They said that their belief is that his body needed to be submerged fully in water in order to go to heaven. So I thought to myself, there's no way that this can happen. If I disconnect him from his IV medications, he's gonna die. And that wasn't gonna happen on my shift. So I offered them some words of comfort in knowing what my belief was, and that is that God is a loving God, and that no matter where you are, if you just ask him into your heart and ask him to forgive you for all of your sins, that he will forgive you and you'll go to heaven. Although those words were kind to them, they thanked me, but they still declined that. So at that moment, something came over me, and I realized that this is what God wants to happen for this man. That I needed to make sure that him and his family knew that when he died that he was going to go to heaven. I needed to make this happen. So with what seemed to be an eternity, in reality was only a couple of hours, his church family brought in this enormous portable baptism tub. It was about the size of a hospital bed. We brought it into the ICU and sat it next to the patient's bed. His church family helped to fill the bathtub up with water using wash basins and using the water from the ICU sink. Then I coordinated to have 2 of his brothers at the head of the bed and 2 at the foot of the bed. And we decided that on the count of 3, I was going to remove all of his monitors and his IV medications. And so we did. On the count of 3, 1, 2, 3, I disconnected everything. His brothers lifted his body and submerged his body in water in the baptism tub. With his pastor at his bedside, he was able to be baptized while he's fully submerged. As his body was lifted back up out of the tub and into the bed, there was an outpour of tears and joy in the ICU from my team and from the patient's family and friends. As I was driving my patient off, and I reconnected all of his monitors and his IV tubing, he looked up at me and he thanked me. I knew that he was at peace. One thing I know for sure that day, it wasn't about me or what I wanted to happen for this patient. It was about what God wanted. It was that he needed to know that this patient was going to go to heaven. So if you ever feel that something might be impossible, think again. It really isn't. That day really was a beautiful day.